Good morning. This is Abraham Segrist with the Virginia Hospital and Healthcare Association, and welcome to today's webinar, Improving Patient Experience in Virginia Hospitals and Health Systems. I will review a few housekeeping points before we get started. So today's webinar is being recorded. All participants are currently in a listen-only mode. When we get to the point of asking questions throughout the webinar, you may ask questions by typing your question in the question box, or I will also unmute lines at that time and allow folks to verbally ask their questions as well. The slides are available for download in the handout section of the webinar control panel. The slides and the recording from today's webinar will also be available on the VHHA Quality and Safety website within a few days. And finally, at the end of this morning's webinar, we will launch a brief survey asking for your feedback. So today's agenda, I will provide a brief overview of VHHA's year of patient experience, review the objectives for this morning's webinar, and then turn over to our speakers, Mr. Bush Bell and Ms. Lori Mays from the University of Virginia Health System, and then our colleague Carrie Brady will conclude the presentation this afternoon. So just a reminder, the vision for the Virginia Hospital and Healthcare Association is that through the power of collaboration, the association will be the recognized driving force behind making Virginia the healthiest state in the nation, and we pursue this vision through working with our members and other stakeholders to pursue a number of specific activities, including continuing to improve the healthcare safety, quality, and service that's provided across the Commonwealth. Listed on your screen are all the member hospitals of the Virginia Hospital and Healthcare Association, and they represent over 110 acute, behavioral, and pediatric hospitals in Virginia. At the beginning of the year, our board of directors, along with the leadership here at the association, declared 2020 to be the year of patient experience. At that time, we didn't know that 2020 would also be the year of COVID-19, but this morning's webinar will be an opportunity for us to explore how those two things align. The goals for our year of patient experience was to identify, highlight, and celebrate efforts occurring within Virginia hospitals and health systems to improve the patient's experience of care. We wanted to continue to link and integrate patient experience improvement efforts with broader quality and patient safety improvement efforts. Always seeking to connect hospitals and health systems with each other and other stakeholders for the purposes of shared learning. And then ultimately, we want to improve the quality of the patient experience for all of our family and friends, and to improve our individual and aggregate performance on national patient experience measures. So today's objectives, our colleagues from UVA Health System will review with us their Care Partner program. They'll also discuss the impact that COVID-19 has had on their patient experience efforts. And then we would like to solicit some input and feedback from you all regarding your patient experience improvement efforts and the impact of COVID-19. So at this time, it's my pleasure to turn the presentation over to our colleagues from UVA. I believe Lori Mays, the Patient and Family Education Coordinator, will speak first, and then she'll be followed by her colleague, Bush Bell, the Patient Experience Officer at UVA. So Lori, I'll turn the presentation over to you.
Okay. Thank you, Abraham. It's nice to have so many of you joining us today. So I am actually going to share with you, speak to you about our Care Partner program here at UVA Health under what we considered normal inpatient visitation pre-COVID-19. And we certainly hope that we can return to that state again in the not so distant future. So our Care Partner program initially began nearly 15 years ago with two main objectives. Sorry, thank you, Abraham. One was, as part of our practice model, we wanted to incorporate the family as part of the care team. And two, we wanted to ensure Hipaa compliance when providing patient updates to visitors, either in person or on the phone. Those of you who have worked in inpatient settings pre-HIPAA likely remember the days when we would give patient updates to any friend, family, neighbor, church member who called to get information about the patient, which could also be very time-consuming for staff. So as the Privacy Act evolved, we wanted to create a system to, again, ensure that we were only giving information to the appropriate visitors. So we do use the same care partner guidelines for all of our adult and children units, with the exception of our NICU, which does have tighter visitor and care partner restrictions. So who can be a care partner? So it's one or two adults, obviously 18 years or older, and we do frequently have to address that issue as we have some 16-year-olds of visitors that will often want to stay. So we do have some areas that we often have to address, but we do note that it does need to be an adult. So they're identified either by the patient or the surrogate decision maker who is going to actively support the patient while they're here in the hospital. So the care partner may or may not be the legal decision maker. They must be healthy and able to care for their own needs. We do offer $5 meals for care partners from nutrition services. We can also offer them services at our outpatient pharmacy that's open 24/7. And if needed, we can provide some social work support for them as well. So next slide, please. So the role of the care partner is essentially the person who receives the medical information about the patient, and then they are going to share that with other friends and family. We really encourage them to be an active participant of the care team. They have evolved in being part of the daily rounds with the medical team, learning what the plan is for the patient. They can help provide patient care in any capacity that they desire, as long as it's safe for the patient and them to do so. And we do allow one care partner to stay at the bedside overnight. So how do we identify our care partners? And this is obviously important for our Hipaa compliance. We do have them wear an armband at all times. We do have 3 different color armbands, one identifying on regular adult units, one for our children's hospital, and one for our mother-baby units. So they also can bypass getting a daily visitor pass if they display their armband. And we also give them a 4-digit security code that helps us identify the care partner on the phone. And for safety purposes, for that number, we use our contact serial number and our EMR, and that's a unique number for each admission versus a medical record number that's always the same and tied to that patient in the event that there would be a visitor restriction in a future admission. We officially identify the care partner on admission. A lot of times we try to have, if it's a planned admission, we try to have conversations about the care partner in the clinic setting. And also our health unit coordinators have EMR access to the care partner information, so they can also help the busy nursing staff identify who truly is the care partners when they're seeking information either in person at the nurse's station or calling on the phone. Next slide, please. So we thought we would share with you also what some of our supporting resources are, and I honestly didn't realize until I was looking into this how many supporting documents that we have. So to help support and empower our staff with our care partner program, it's referenced in our medical center visitation policy. We also have a nursing clinical policy for our care partner program. And then we have multiple, I think I saw at least 6 standard work documents that help guide staff from orienting and initiating the care partner program and even care partners of patients on isolation, and also even addressing needs of care partners while they are here. As far as support for the care partners themselves, we offer a verbal explanation along with a handout to identifying the care partner goals and guidelines that they are to follow. We also have an overview of our care partner program on our public website. So as you can imagine, our care partner program has had multiple updates over the years, but overall it really improves the hospital experience for the patient, family, and staff. Next slide, please. So as I mentioned, this is our program outside of COVID, and I'm going to be turning it over to Bush, who is going to share how we have adapted in the time of COVID-19.
Thanks, Lori. So when Abraham and Carrie asked us to think about presenting around our Care Partner program, it was probably 4 or 5 months ago, and of course we gladly accepted that. But as COVID rolled in, it really required a lot of changes in our visitor policy, and adjusted and modified some of the features of the care partners as we introduced our restrictions around visitors. So when we think about today, we are still in a highly restricted environment for visitors. We do not have open visitation. Visitors for our inpatients are only by what we call designated visitors, and designated visitors can only come if the patient is at the end of life. Of course, parents of pediatric patients are allowed to be with the patient, the pediatric patient 24/7, one parent at a time. Moms that are actively in labor can have a partner with them. Adult patients with various special needs, either physical or cognitive, or other special needs, may generate a designated visitor exception. And then just recently we've added long length of stay. After being kind of in this mode for about 45 days, we were really starting to see many patients that have been here for more than 6 days needing to have that connection with a family member. So we now every 6 days will allow a family member to come visit for 4 hours. And so these designated visitors may be care partners or they may not be. So Lori talked about it. One of the key features is this ability to call in and get information by the care partner by phone. And so that care partner could be in California, it could be anywhere, but they may have a local person that may not be as integrated into their care as a care partner, but may be wanting to come or have an opportunity to come and be with the patient during these exceptions. So we know that having patients at the bedside is critical to the patient's journey and getting better, as well as their general experience. And we've even Care Partners, as Lori said, has been around for 15 years. And when CMS started opening up visitation, we were very open about